One of the most common conditions we treat, especially in our runners, is a condition called iliotibial band friction syndrome. Before we start working on the IT band and the TFL, I just want to show you a special orthopedics test. It's called the Ober test. If you bring the hip into extension and lower the leg, and when you're lowering the leg, if it's very springy, then it's an indication that this muscle is very tight, and of course that's limiting their range of motion and changing the way they run and changing their gait. So what we really want is that IT band to be stretched out enough where the leg hangs below the table. So in this case, if there's that springy motion, we want to start up here in the gluteus minimus. So I'll just bring his leg back up on the table and start stripping. Not stripping his clothes off, but stripping the muscle. Just want to get in there as far as the muscle will let you go and do a deep stripping through the glute medius. We'll get more into treating the glute medius in our advanced class. And we get down into the TFL. And then when we get into the IT band, you can really feel where it gets stuck. Feels like it's kind of stuck down to the bone. So in that case, you just want to pick it up and pull it away first to get some circulation going in there. Otherwise, it'll be very tender and uncomfortable for your client. So just do a full-handed petrissage, pick it up, pull away from the tissue, and then start stripping from lateral to medial. Pick it up on your way back. When you work down into the attachment, into the lateral knee, you'll feel where that fibrotic knot is, where it's been frictioning, building up scar tissue. You just want to friction that attachment. And it also works well if you have them. We're going to change his position here by bringing this knee forward, this leg straight, and I'm going to find where that scar tissue is and just move his leg back and forth as I friction and make that scar tissue more mobile. Do that for several seconds. Then we're going to bring him back into a stretch again, and then bring the knee up towards the chest. I'm going to bring his leg back, and then I'm just going to place 2 fingers right on the lateral side of his knee with gentle resistance. I'm going to ask him to raise his leg up just as high as it wants to go, and relax. That helps retrain the IT band, and then we'll bring it into a stretch down and back of the table. Now we're going to talk about the firing pattern that should occur here in the IT band and the glutes to reduce back pain in our next workshop. But this is a really good pain-free way to reduce the tension in the IT band so they can get back to their running activities. And it's a good idea to do some cross-training as well to strengthen the hamstrings, so the hamstrings and the quadriceps aren't having to work as hard, and the IT band has to make up for their strength or lack of it.